The meeting agreed that the ongoing health workers' strike should be called off immediately and all officers return to work unconditionally. It was also agreed that all the issues raised by the health workers will be addressed exhaustively. The quick wins are to be implemented immediately, while matters with budgetary implications will be addressed with effect from 1st July this year. It should be noted here that no officer will be victimized for participating in the strike, and therefore disciplinary letters which had been issued to various health workers have been withdrawn. However, the workers who fail to report on duty by the end of tomorrow, that is Thursday, 15th March 2012, will be liable for disciplinary action individually and in accordance with existing regulations for public servants. To address issues that have been raised, a task force is to be constituted immediately to look into both medium and long-term solutions to the problems affecting the health sector. Basically, what we are saying is that we have had a lot of issues, and this task force will be looking at how to reform the health worker sector so that the problems we have now will not be experienced again. Were matters that had been taken to court, but it regarded the misunderstanding that was there. Now we are saying we have no more misunderstanding. For example, one of the issues which was contentious was whether some workers were going to be disciplined, sacked. Now that has been discussed and agreed that no worker is going to be victimized. And therefore, as they return to work, we are going to meet and both parties will meet and go to court and say there's no dispute anymore. And that matter will be taken out of court. But basically, there are issues of allowances, issues of salaries, issues of working conditions, issues of promotion, other benefits, etc. Now, the very quick one has to do with the extraneous allowance. In fact, part of it is now being implemented with effect from 1st of December, where the workers had demanded extraneous allowance. Phase 1 of it will be paid to workers. It is the amounts varying between 2,500 to 7,500. Then from 1st of July, that is the new financial year, the second part of that allowance is going to be implemented. And it basically means that it will double up. Issues to do with the other issues which the task force will now be looking at will involve, for example, we know nurses who have been engaged under ESP, Economic Stimulus Program, and so on. So these are issues that require policy guidance. Then, of course, issues to do with the salaries, house allowance, which have to be looked at in a bigger way, because they do not only affect the health workers, but they affect the entire public workforce.
I'm here on behalf of the health sector officials and the Union of Kenya Civil Servants. Want to confirm to the public that we've had a very fruitful discussions with the Office of the Prime Minister, and what has been read is what we have agreed on, and we are all in concurrence. My last appeal, which I want to make to our health workers, let them resume duty. The concerns which they raised about the letters which were given to them has been addressed by the Office of the Prime Minister. And still, I want to confirm to them that we are committed to their cause, and we as their leaders, what we want from them is only trust. And we are also taking an initiative that we are not going to betray them. We'll ensure that their interest is fully represented, both at the task force level and at the ministry level. Thank you very much.